Okay, gang, here's my last video for this week. So this is for chapter 22, and chapter 22 deals with that special population orthopedic and rehabilitative concerns. So just some terminology that you'll probably see throughout this chapter and some definitions that you should familiarize yourself with are listed here. So a micro versus a macro trauma, like a micro trauma are injuries that result as or that will result from overuse. So for example, somebody is constantly doing step aerobics, maybe taking multiple classes in a day, and then all of a sudden they get this pain on the bottom of their foot, on their plantar fascia. So when they get out of bed every morning, that first step is just a sharp shooting pain in the bottom of their foot. That would be called plantar fasciitis. So that would be inflammation of that plantar fascia, and that's due to the overuse of constantly stepping up and down on that platform, multiple times over the course of the day by taking multiple classes. That's an example of a micro trauma. So they're usually as a result of some type of overuse. Whereas a macro trauma, on the other hand, is a sudden onset. So for example, I was walking down the road and I took a step and my ankle turned and I sprained it. Okay, so a sprain is a result of, an abrupt, sudden onset. So taking that wrong step off the curb and I, turned my ankle the wrong way, and that caused that macro trauma, which is the sprain. So a contusion would be a bruise. So we have bruising that occurs all over our body when we hit it, so contusions. And then a strain versus a sprain. So an ST, a strain is a partial or a complete tear of a tendon or a muscle, whereas a sprain, an SP, is a partial or a complete tear of a ligament. Tendinitis is inflammation of a tendon. So always just remember, when you see itis on the end of a word, itis means inflammation. So in this case, tendon, it's inflammation of the tendon. Subluxation is a partial dislocation, and then dislocation is a full dislocation. Osteochondrosis is just degenerative changes in our bones. So that can occur in our spinal cord, for example. Over time, we have changes in that bone density that leads to degeneration of the spinal cord. Osteoarthritis is degeneration of the cartilage in a joint, which can be very painful. And then bursitis is inflammation of the bursa sac, which is in the joint itself. So those are some common terms that you're probably going to see throughout the course of this chapter. The next part discusses the phases of tissue healing. So let's say that we do have going back here, macro trauma, a sudden issue that happens. So your body goes through this healing process, and sometimes it can take up to a year to be fully healed. But you can see the three phases of the tissue healing process are the inflammation phase, the proliferation or repair phase, and then the remodeling or the maturation phase. So when you look at the inflammation phase, that can last anywhere from 5 to 7 days. Okay, and during that first week, we just see inflammation occurring. So a lot of inflammation, right, occurs at that localized area wherever it may be in the body. Then you move on to the proliferation or the repair phase, which can go from 7 days up to 21 days. So now you're 3 weeks in, and it's repairing itself during this phase. And then you can move into the third phase after 21 days up to even a year. We have the remodeling occur. But now you can see here there's a little bit of overlap in between each of those phases, because it's not exactly, this one ends at 7 days and this one begins at 8. There is some overlap between the inflammation and the proliferation phase, as there is between the proliferation and the remodeling phase. You can see here as far as the rehab goals during those three phases. So what can we do during the inflammation phase? Not a lot, okay? The only thing that we can really do is tell them you need to control your pain, whatever, if they're taking pain meds or whatnot, and we want to try to control that inflammation that's going on. So during that first week, there's no exercise recommended, okay? But when they move into that proliferation phase after that first week, What can we do? We can do range of motion flexibility exercises. We can work on balance, proprioception, neuromuscular control, and we can also work on strengthening. Note, we still aren't back to regular physical activity yet, okay? But once we get to that third phase, the remodeling phase, so now 3 weeks and out, we can now add functional strengthening exercises, and they can pretty much return to normal physical activity. So just as a personal trainer, understanding the tissue healing process, and that if somebody has an injury, we're not doing things within that first week where they have the inflammation occurring. We just want them to control the inflammation and control the pain, and then they can start doing some things after that first week, but not all. So one of the orthopedic issues that your book does talk about is a low back injury. So here are just some basic rules of thumb. So goals, when we look at things like a disc injury, so things like a herniated disc, right, or slippage of a disc. So what can we do during a disc injury or with a disc injury? We can do passive lumbar extension, stretching, note stretching. We can do isometric abdominal and extensor strengthening. So where are your extensors? Think about that. They're in your lower back, right? Those are things that extend the spine. So we can do passive lumbar extension stretches and extensor strengthening, as well as isometric abdominal strengthening. We can progress to lumbar stabilization exercises. What should we not do with disc injury? Do not do lumbar flexion and lumbar rotation. So what is flexion? Remember, right? Flexing at the lumbar region, so bending forward, rotating. Okay, those are not recommended for a disc injury. If they have a muscle strain, an ST, which is a partial or a complete tear of a tendon or a muscle, during the inflammation phase, again, no exercise because they're going through that healing process. But then we can progress to flexion, stretching, and extension, strengthening exercises. So we want to stretch our flexors of the spine and we want to strengthen our extensors of the spine. For a muscle strain, what is not recommended? During that inflammation phase, do not do any passive or active extension or passive flexion or active extension exercises. So during that first week, if they strain their lower back, do not do anything, especially during that first week, right? Even if it's a passive, sit and touch your toes. Don't recommend that they do any of that stuff within that first 7 days. Moving on to the shoulder joint. So we have some different things that can occur: impingement, or we can have rotator cuff issues, or just instability of the shoulder joint. So as far as impingement or rotator cuff, we want to focus on strengthening exercises for the rotator cuff, so those 4 muscles that comprise the rotator cuff. And we want to do anything that's pain-free. So if they're doing an exercise and there's a pain associated with it, and they have rotator cuff issues, do not do it, okay? It's got to be a pain-free exercise. As far as instability goes, again, we want to do rotator cuff strengthening exercises, and your book gives some examples of some great ideas. Also, the articles that I gave you gave some examples as well. So again, make sure you're staying within the safe zone. What does the safe zone look like? Right here. So if you're doing a lateral raise, here to here is the safe zone. Going above that is not. From here to here is a safe zone. Going past that is not. So make sure you're staying within that safe zone when you're doing any of those rotator cuff injuries. So we want to provide modifications for those clients who maybe had a rotator cuff surgery. Maybe they have tendinitis in the rotator cuff. Maybe they've dislocated their shoulder in some way. Maybe they have an injury to the acromioclavicular joint. And they might even have osteoarthritis, which you can see in table 21.5, some examples of things we can do for that. So we definitely want to provide modifications for those issues. But here are just an example of an external rotation exercise, which is a great one to do for rotator cuff strengthening. As far as the ankle goes, we want to first progress gradually from doing non-weight bearing exercises to weight bearing. So don't start off on their feet, start off on the non-weight bearing stuff. And then we can incorporate the strength training, any range of motion exercises, and balance, right? Getting on the BOSU and doing balance exercises to strengthen those muscles that surround the ankle joint is always a great thing to do. As far as the knee goes, things like anterior knee pain and ACL issues can occur. So for anterior knee pain, we want to work on squats, leg presses, but we only want to do a quarter to a half instead of a full range of motion. So we want to avoid anything that's a full range of motion. Okay, that end range of motion is going to be tough on that knee. Okay, so we can do partial lunges, we can do partial leg curls, but again, we don't want to go through that full range of motion because that's going to aggravate that knee pain. We want to try to reduce the inflammation and the pain. So somebody who is having that anterior knee pain, they're constantly having that pain and that inflammation. So if we're going to do anything of this nature, it's a quarter to a half instead of a full range of motion. So avoid the end range of extension. So when you're extending the knee, the end range is if your leg is straight out. We want to avoid that end range of extension. ACL issues, we want to make sure, again, you're doing maybe a 3/4 squat or a leg press. We don't want to do a full range of motion. Step-ups are okay, and then stiff-legged deadlifts, leg curls are okay as well. But what do we want to avoid? The end range, again, of the leg extension, and anything open chain greater than 45 degrees of knee flexion. Okay, so looking at the leg curl, the leg extension exercises, be cautious of those end ranges of motion because that can further aggravate these knee injuries. And then lastly, looking at the hip, well, the hip is a tough one. You know, if people have hip replacements, we definitely want to follow any guidelines that the healthcare provider gives. So we want to first ask, what did your doctor say you can and can't do? But then from there, water. Get them in the water is probably the best place for these folks who have hip issues because it's non-weight bearing, it's less stressful on that joint, and it feels good. So anything in the water is very, very good for those individuals. And then if we can get them on the land, working on some balance, because these people, you know, older adults have a higher fall risk, they lose their balance, and then they have brittle bones, they have low bone mineral content, and then they break a hip or they fracture a hip because of that low bone mineral content. So especially working on balance so we can prevent a fall in the future is key for this population as well. So that is it for chapter 22.